discussion about clinical presentation of intimate partner violence in hospital settings and community settings. For this, I would like to welcome Dr. Jaya Devendra ma'am, Professor, Department of Ophthalmology, Mahatma Gandhi Medical College, Jaipur. Ma'am has done MS in Ophthalmology from Patna Medical College, MBBS from MGM Medical College, Jamshedpur. Ma'am is an expert in phacosurgery, manual small incision cataract surgery, trabeculectomy, and other ocular surgeries. With a short intro, I'd like to welcome ma'am.
Thank you so much, Dr. Venkatesh. Am I audible?
Yes, ma'am.
Okay. I would also like to thank Dr. Parmita, the organizing chairperson, and Dr. Ashish Pundir, the organizing secretary, for inviting me to be part of this topic, which is very, very relevant in the current scenario. Okay, just a second. So I'll be talking about intimate partner violence from an ophthalmological perspective. Why do we need an ophthalmological perspective? That's because if we look at the statistics, we will see that ocular injuries and injuries of the eye and the area around the eye are very commonly seen in IPV, and more commonly in women, 73%, as compared to men, 26%. And the commonest age group would be 21 to 30 years. Also, head, neck, and facial trauma are present 7.5% times more commonly than other injury types in patients of IPV, and 45% of injuries involve the eyes. If we take orbital fractures, then IPV is the third leading cause of orbital fractures after road traffic accident and fights. In males, the most common form is either being struck, that is 66%, or fire, 30%. And in females, 90% of the time, the injuries in and around the eye are due to being struck. Injury patterns that are seen most commonly are contusions, abrasions, puncture wounds. They may also be chemical or thermal burns, laceration of lids, conjunctiva and sclera, orbital fractures, hematoma, hyphema. Hyphema means blood in the anterior chamber of the eye. Also, lens may be dislocated and even the retina may be detached. Most commonly, the information about the cause of injury is not forthcoming. I would like to highlight this point further. I remember there was a patient and she had injury around the eye and she had presented to our OPD with her husband. And when I asked her how she got hurt, she would look very angrily at her husband and she would say, "Hum darwaze se lad gaye." Now, her injuries were not consistent with the cause that she was giving. And also, I noticed that the husband's behavior was very suspicious. He would say, "आप दवा लिख दीजिए जल्दी से, बस इतना पूछिए नहीं, आप दवा लिख दीजिए और हम लोग को जाने दीजिए." So I took more probed further, and I took a deeper history. And then I found out that she had been struck by her husband. So we have to be very, very careful when taking the history. If we find that the injuries are not corroborating with the cause, then we should probe further and we might come up with the fact that this actually is a case of intimate partner violence. In many cases, the partner who caused the injury will accompany the injured partner to the OPD. I remember another case where I think it was around Diwali time, a woman had struck her husband because he was an alcoholic. He was old and debilitated, and she was accompanying her husband and she was not allowing him to speak. So we have to be very, very, we have to have a high index of suspicion where we see injury patterns like this. Healthcare professionals have to be very vigilant to recognize the subtle signs of intimate partner violence injuries. Like supposing if generally men are right-handed. So when they hit the women, if you notice injury patterns that are all on the left side of the face, then even ruptured eardrums, then you should be thinking of somebody who has been slapped with the right hand. So some of the types of injuries that we can see: subconjunctival hemorrhage, it is extremely common, that is blood under the conjunctiva. You may see ecchymosis, which is a black or a blue eye. You may see full thickness lid tears. These are generally seen when the patient has been struck by a rod or a stick or any hard object. You may even see a scleral rupture. Fracture of the inferior orbital margin and floor of the orbit. The left side picture shows that. You can see that the eye is depressed. Such patients will not be able to move their eyes normally. You can see the normal eye is looking up while the injured eye cannot look up. Patient may complain of double vision, extreme pain. The next picture is showing high femur, where you may see blood in the anterior chamber of the eye. Also, the lens may be subluxated, or they may even be a traumatic retinal detachment. Now, both these last two things, you will need an ophthalmologist to be able to diagnose this. Symptoms may include blurry vision, decreased or double vision, along with pain in and around the eye, black and blue bruising around the eye, swelling of the forehead or cheek or eyelids, redness of the eye, difficulty in moving the eye, intense cheek pain when opening the mouth, and bulging or sunken eyeballs. Females are more likely to disclose intimate partner violence when questioned by a doctor. So if you do take a history and show your concern, females will open up. But it is not the case with males. Maybe there is some amount of hesitation and embarrassment. So screening is especially important in men, as they are often not even perceived as victims of intimate partner violence. Also, ophthalmologists and doctors should be educated to improve referral rates to social workers and law enforcement agencies, because intimate partner violence is often an ongoing rather than a one-time incident. So the job of a doctor does not just end with just, prescribing the treatment for the injuries. We have to understand that this may be an ongoing thing for that family, and we have to refer them to the social workers and law enforcement agencies so that this does not recur. And with that, thank you very much.
Thank you so much, ma'am, for such a visually appealing and a crisp presentation. So,